Magnetic resonance imaging, or MRI. What is an MRI scan, and what are we looking for on MRI scan? MRI scans are very sophisticated medical imaging that takes longer to get than a CT, usually maybe 30 minutes, and there's a loud noise when you get an MRI. It's done by magnetic resonance. So it sends a magnetic wave through the body, and it is measuring the way the protons in the body are shifting in response to that magnetic energy. MRI scans are really good at looking at the nervous system. So we use MRI scans all the time. It gives us very good detail of the brain. It gives us good detail of the spinal cord. We can trace out individual nerve roots on an MRI scan. It also shows us the discs really well, and it shows us the ligaments, especially the ligaments in the spinal canal that may be contributing to lumbar spinal stenosis. Two other things that MRI scans are typically used to evaluate. One is tumor. If a patient has a tumor, an MRI scan, usually with contrast, is the best test to evaluate for tumor. Another is infection. Again, with contrast. MRI with contrast can be a good way to look for an abscess in the brain or a patient that potentially has discitis. So I understand that MRI scans are not the most exciting experience of your life. And I unfortunately need an MRI scan in most situations to make a formal diagnostic opinion. And we use the MRI scan considerably for surgical planning and decisions around intervention. You should also know that in the vast majority of my surgeries, the MRI scan that the patient has taken before surgery is displayed prominently in the room. And I will even reference the MRI scan during the operation to remind myself of exactly what pathology we are targeting. So in summary, MRI is excellent for looking at the brain, the spinal cord, the nerves, the discs, and ligaments in the body.